Hi, this is Dr. Ryan Kazemi, and thank you for joining us. This presentation is part of our bone modification series for developing sites for dental implants. Total implant success is dependent on a number of factors, including proper diagnostics, 3D digital planning, adequate bone quality and quantity, precise implant positioning, selection of right-sized implants, and certainly following a very strict prosthetic guided treatment protocols. One additional factor which comes with great experience in manipulation of hard tissue is implant site bone modification and management techniques, which is crucial to proper implant healing and stability, both during the healing phase as well as once the implants have been loaded. With so many bone modification techniques and tools that are available, today I would like to discuss the combination of osseodensification and internal sinus lift techniques in a patient planned for implant replacement of his upper first molar, and demonstrate how we can develop our implant site to achieve more predictable results. Our diagnostic CBCT in this patient demonstrated an 8 millimeter of available bone height due to proximity of the sinus floor and presence of excellent amount of bone width. While a short and wide dental implant can be placed in this site, it is certainly possible to develop the site further in order to accept a 10 millimeter implant, which offers us more surface area contact and benefits of long-term stability. This is particularly important in the posterior maxilla, where the bone quality is often less ideal, or in patients where we anticipate greater occlusal forces. We also like to place the implant in single-stage fashion with the healing abutment, providing that we have achieved great implant stability. So our surgical objectives are to gain 3 to 4 millimeters of additional bone height and convert our bone quality, which is most likely a D3 or D4 bone, to a more dense D1 or D2 level. So I'm going to discuss the two techniques for achieving these objectives. First, we'll use osseodensification. It's a relatively new concept that, in my opinion, is one of the most exciting advances in implant site development. The technique involves the use of specially designed burrs that can be used for both osteotomy as well as osseodensification when used in reverse mode. It increases bone density at the osteotomy site, expands the alveolar ridge where it may be thin, and it can also be used to increase the height of bone in the posterior maxilla by its sinus lift application. We'll also demonstrate the internal sinus lift technique using a series of sinus osteotomes. So here, we'll first create a mid-crestal incision and raise a very conservative submucoperiosteal flap. The initial osteotomy is done using our surgical guide and then verified with a guide pin and a periapical x-ray. We'll then continue the initial osteotomy using the osseodensification burr at about 5 to 6 millimeters depth, which is approximately 3/4 of our available height of bone. Next, we'll use an internal sinus lift osteotome and displace the apical bone more superiorly to about the 10 millimeter mark. Then we'll place the osseodensification burr again in the reverse mode to densify the bone and expand it laterally and apically. We can also use it in the osteotomy mode to advance within the site if the bone is found to be particularly dense. Then we'll place the next size sinus osteotome and raise the floor again. We go back again to the osseodensification burr and continue the osteotomy and the densification process using wider burrs slowly advancing it to about 12 millimeters. We'll go back and forth and keep raising the apical bone and densifying it in all directions until we have reached the right diameter and our desired height of about 12 millimeters. Using the densification burr in forward mode prepares the site, removing bone from the lateral and apical sides, and then immediately compacts it and moves it apically when it is reversed. Next, we'll place mineralized freeze-dried bone in the osteotomy site and push it toward the apical aspect of the osteotomy using a bone plugger. Then we'll use the last osseodensification burr in about 800 to 1000 RPM in reverse mode to drive and compact that bone more apically and laterally. And this can be repeated again with additional amount of bone graft until the sufficient augmentation and lift has been accomplished. Next, we'll place the implant. While the implant was being rotated into position, a very high resistance was noted when the implanted platform was about 3 to 4 millimeters from the crest. This was a reflection of the great density of bone, most likely a D1 at this time, which we were able to achieve with the osseodensification process. To avoid excessive force and damage to the internal hex, the implant is backed out and removed. We'll then go ahead and modify the site further and prepare it for the implant using an implant bone tap. The bone tap is rotated until it's fully seated and then backed out. And then at this time, we can proceed with the placement of the implant until it is seated fully. The healing abutment is also placed knowing that we have great primary stability with no concerns about occlusal loading on the healing abutment during its healing phase. So here is our final implant in place and development of the apical bone beyond the implant apex. We'll allow the implant heal for about 3 to 4 months before its final restoration. Osseodensification, in combination with minor internal sinus lift technique, is a great approach in managing sites in the posterior maxilla where augmentation of the vertical and horizontal bone is desired for improved implant stability and longevity. Thank you again for joining us today.